Hello, everyone, and welcome to Adoctorsjourney podcast, navigating life and medicine with coaching and healthcare innovation. The purpose of this podcast is to share content that is valuable to physicians and healthcare workers in general, how innovation can allow us to close the breach from inefficiency of our healthcare system and what can make us prevent and manage burnout and the challenges of our work environment. And today I'm going to talk about burnout. This is a topic that is very rooted into my heart as I've been burnout myself back in 2016. That's how I came across coaching. And through coaching, I was able to overcome a lot of my limited beliefs. And I've been doing coaching now for a long time and decided to become myself a certified physician life coach. And I'm also now a positive intelligence coach and help physicians to build techniques and strategies and frameworks that they can implement into their life and try to tackle this phenomenon. First, I want to mention and bring the elephant into the room. When we talk about burnout, we can talk about two different aspects. We have the rooted concept of moral injury that is driven by our environment. Our healthcare system is inefficient. Unfortunately, is revenue driven. We lack of leadership in many areas. And we have so much delays on implementing new clinical guidelines, and we have so much delays on updated policies in healthcare. And all that is part of the reason why, if we tag that with the fact that a lot of physicians are not having the autonomy to practice medicine because they are employees to hire or more than other healthcare system, that has become a fuel for moral injury. On the flip side, there is a lot of things within the concept of burnout that are residing within us, with the lack of clear priorities, clear goals that are aligned with our values and life and purpose. And I have coached a lot of physicians that after years and years of pain and suffering, finally, out of desperation, they take the leap to try to make changes in their life. And believe me, sometimes might include having to change your job, reduce your clinical shifts, or anything related. But a lot of times, it's just about how you approach your work environment. And that's where coaching can be very useful to help you gain clarity on what you want to do with your life and have to build this purpose-driven effort that will make you feel more fulfilled in your life, in your work, and personally as well. I'm going to ponder the question, who comes first, the patient or the physician? And I'm going to tell you, I have asked these questions in many different venues, and at least 2/3 of the time, the answer will be the patient comes first. That's the way we've been trained. That's the way we are, like warriors going into the war environment and try to survive. We're advocate of our patients. We want to help them. We want them to get better. But it's interesting that paradoxically, we don't care of ourselves. And we usually, quite often, when we approach caregivers, we give them the example of they need to take care of themselves. Otherwise, they will never take care of others. But this is something we usually don't follow ourselves. There are multiple definitions of burnout, from a psychological syndrome that emerging as a prolonged response to chronic interpersonal stressors on the job. I like the concept of energy-driven, a consumption of energy due to excessive demands by either family, but specifically work, and that basically steal the person's energy, coping mechanism, and inner strength. But I like also the definition of a mismatch from our values with the current position that we are performing. And so many times I came across physicians, that's the main issue. They are just not a good fit for the positions that they are working at. And sometimes, once again, the issue is the lack of clarity of why you truly want with your life, but in this case, with your work. And sometimes it takes time, it takes reflection, and that's the part where in our current environment, automatic life, we miss that time to kind of set clear goals based upon the clarity of what you want to do. There are hormonal changes also related to burnout, from high cortisol level that will drive into accelerated atherosclerosis that could be evidently quite dangerous for our future and our longevity. There is increase in glutamate levels that decrease your fine motor skills. There are anatomical level changes that would affect your focus and decision. We become reactive to stress. Our amygdala becomes hypersensitive to any stressor. And we also have reduced short-term memory. What are the stats? 1 in 2 physicians are burnout. 2 in 3 nurses are burnout as well. 50% of physicians are entertaining a career change within the following year. And that was back in 2020. After COVID, I can assure you that the number has increased dramatically. Healthcare workers' suicide is up to 400 physicians and 700 nurses that we're losing every year. If those stats are not eye-opening to anyone that is ignoring the reality of this phenomenon, is basically just being in full, complete denial. I want to ponder a few of the symptoms I experienced myself when I was burned out, and I want you to take a time and reflect and see if you have any of it. Are you feeling disconnected with your coworkers? Have you been irritable or confused? Do you have an inability to get excited about tomorrow's assignments? Difficulty focusing or remembering? Or procrastination or lack of motivation to complete any assignment at work? Have you been there? I have asked these symptoms in different venues, and I'm going to tell you that at least 80% of the time, someone or the audience will have at least one of these 6 symptoms. And I will say that around 30% of the time, I have people responding that they have 4 or more of these 7, which is one of the severity of burnout symptoms that we need to address on our life. Now, why, if burnout is so frequent, and even though there are external drivers that are outside of our control, there are a lot of internal drivers that we do have control over, why we don't seek change? There are multiple cognitive distortions. I'm just going to share a few of them. The arrival fallacy. We always feel that the next step in your journey will be the one that will show us or get us that happiness and fulfillment that we want. But that never happened. I've been there before. I was a hospitalist, becoming medical director. I started feeling like burnout. My quality of life was going a little bit down, even though I was very fulfilled professionally, and I really truly enjoy doing it. But I still feel that disconnection from that improvement in my profession with the worsening quality of my personal life. So I continue growing. I doubled down, feeling that each time I was going up on my journey or escalating the executive ladder, I was going to feel better. And of course, that never happened. That's the arrival fallacy. We are rooted into the physician nurse persona. We feel like we cannot change. We went through these years of training, and even consider a change feels impossible. But let me tell you, physicians have the skill set to be successful in any job or position. Inside, yes, but also outside of medicine. And you have options of what you want to do. One of my missions is precisely being able to connect physicians with new healthcare startups that are interested in getting advice from physicians and getting involvement through it, because I truly believe that we need to drive the change of our healthcare system 2.0 that is being on the works, but it will take some time to get it to the frontline provider. We have the imposter syndrome. We feel like everything needs to be perfect before we change or we make a decision. And let me tell you, there is not 100% certainty in any decisions we make. That always will have to navigate struggles in our decision-making process and the outcome that we're seeking. But what is the cost of doing nothing? And that's the thing I want to make sure you understand. The second thing is, remember, Einstein's definition of insanity is doing the same thing over and over again, expecting different results. But we also get into the comprehension trap. We feel like by knowing a concept, we can definitely implement it, or by reading self-improvement books, we're going to change our life, and that's not how it works. We studied a concept, we understand it, but we fail to implement it into our life. I invite you to build that sense of agency, that sense of purpose about why you're doing something. And the how will reveal to you in front of your eyes. You have that wisdom. And this is what I share with my physician clients. What you truly want to do with your life, with your work. And believe me, it can happen. I was there back in 2016 and I felt out of desperation, I started to make massive changes and ended up taking massive action. But I'm hoping that you don't get to that point and you can make changes now if you feel a change needs to be made before you get into the deep-rooted moral injury that becomes harder. I have many physicians coming through my program and they basically have PTSD just for being practicing medicine for 10 years with the same healthcare worker, with the same position, with the same environment, with the same toxic environment, with hostile bosses and things like that, but never pursue change. But once they make the decision that I need to change something, when you start making those changes, you build a momentum. I call the big momentum, and you escalate and compound into that momentum. And sometimes that starts with a simple decision. And I'm going to give you one simple decision to start doing today. Be grateful. Be grateful for what you have. Be grateful for being alive. If you have a family, for having a family. Be grateful for having a profession. Reflect on at least 3 things that you're grateful for, because that will put you to a mindset of positivity. If you are trying to make a change out of negativity, out of anger, believe me, most likely you might get what you want, but you won't feel fulfilled or happy. But your change is being driven by positivity, by eagerness, by massive action, by great big momentum. You will see the difference on the results. I want you to set priorities on your career, health, relationship, and finances. You need those 4 things. I have clients coming to my programs that they focus only on finance and ignore relationship, or they focus only on their career but ignore their health. And believe me, over time, the odds are against you that you will find what you want, that you will fulfill your purpose. But more importantly, very likely, you will never feel fulfilled and joyful. Now, these 4 things I was mentioning, you don't need them to be equivalent. In life is about transition and things might change over time. You might need more or less of relationship, more or less of the finances, and you can make decisions to kind of adjust your ways of living, to adjust to what you want to do or the career you want to pursue. But definitely you need those 4 things at any given time in your life, even if you're going through residency, school of medicine, and so on. Once you identify what you want, the how will reveal itself. And we have multiple resources at the Adoctorsjourney that can help you set those decisions. I love decision journal. I love frameworks that you can implement into your life. And I love process improvement. I have done research, quality improvement research in hospital medicine. And surprisingly, now I call process improvement for life, because there's a lot of framework you can implement to your own life to make it better. Rituals, macro changes that can drive you into making significant exponential change over the coming months or years. Remember your energy levels at the physiology, emotionality, psychology, and spirituality. You need to be paying attention to all these energy levels through the day. Let's talk about emotional capacity. You drain your emotions through the day. We're dealing with sick patient, people that is near death, and so on and so forth. And therefore, you get burnout just by being drained all the time. Therefore, it's good to have time to recover, time to wind down, time to reflect on how the day went. Be grateful for the good things sometimes we ignore, even if it's the smile of a patient, and even if it's a good outcome. Sometimes we feel like that's meant to happen, and all the negativity is what builds in your brain, because your brain is not helping you to do what you want or you to get what you want. It's just designed to make you survive. And therefore, when you have this reactive amygdala, we get to 3 things: a fight, flight, but the more important I see nowadays with physicians, the freeze response. That leads to inaction, and that leads to career stagnation. You're no longer growing. When you're not growing as a human being, you're walking back. There is a lot of evidence about what coaching can help. But I'm going to leave you with these questions. Are you willing to live every day to the fullest and enjoy every moment? And let me ask you, what is the biggest decision you can make in your life right now? You can always check www.adoctorsjourney.com and you will find more resources. We always enjoy to connect with people. I would suggest you to start working toward this. And when you have results or you need any help, happy to serve you. Just connect with us. Thank you.